what is the difference between a chiropractor and a physiotherapist, and who should you see? So look, in the modern day, there's going to be a lot of overlap, which is good, which is very, very good for you as the patient, okay? But the two sides of the story, I would almost say it's the two sides of the same coin, okay? But the big differences are, if you're going in for a knee surgery, shoulder surgery, let's call it a knee replacement, for example, you're not going to be going to the chiro right after your surgery. You're going to go to your physio. They're going to check your milestones. They're going to check your range of motion, your pain levels, and they're going to treat you and deal with that and get you strong up to a point. Once the pain's gone, they'll send you off to a bio, hopefully, okay? And then if you want to work on other things, maybe some quad-related issues or whatever it might be, you can then go to a chiro, again, with reasons depending on the surgery, okay? On the other side of the chiro, a little bit more sometimes diagnostic work. So what do I mean by that? We're a little bit more trained in terms of picking up red flags. Not necessarily that we're treating it, but picking up like this, listen, this is a problem, this is a quad equina syndrome, this is a stroke, even though the physios can do that as well. The chiro is going to be able to send you immediately for x-rays or an ultrasound, technically an MRI or a CT as well. Little asterisks there with the medical aids. But that's kind of the big two differences. But there should be, in terms of the approach, in terms of the treatment, so if you've got a back pain or a shoulder pain or a neck pain or like a muscle injury or runner injury, both can treat them, okay? At the end of the day, you need to go, one, to where you're getting the results, and two, who you get along with, because that's important, okay? If you're going to this chiropractor or even physiotherapist and he or she is extremely good, but an absolute horrendous personality, that is going to influence your willingness to go in and also your influence your results potentially. So I hope that clears those two differences out.